Hello and welcome to Conversations with Dr. Westman. Today we're going to be chatting about the topic of fasting. Hi, Eric.
Good. How are you, Glenn?
Very, very good. Thanks. Boy, oh boy, this is a contriversial one, isn't it?
I hear lots of different things.
All right.
No, let's
So
make it simple, though.
exactly, that's what we aim to do on this channel. So because it causes so much confusion, help us define your interpretation of what fasting actually is.
Right. Well, it's important to know that there are a lot of different definitions of fasting. So you ask one expert, you'll hear one definition. You ask another expert, you'll hear another definition. And scientifically, fasting means you're burning fat, or you're in a fat-burning sort of state, meaning ketosis. So I think this is a good thing. However, fasting in the common world that I hear people talk about is just not eating. And not eating for a long period of time, well, you take that to the extreme, is not a healthy thing to do. So somewhere in the middle is where you want to be, where you're not eating so much, but you're in a fat-burning state of fasting. So the first thing you want to do is take just a little time to learn just what is this person talking about when you're talking about fasting and intermittent fasting, which means not totally fasting, I mean you're eating something every day. And then what are you supposed to eat? I think that's the most important thing that people miss out on. I hear people talking about the hours of the day and all this and dropping breakfast, which is fine, but it's more important to talk about what you're eating and what you're not eating.
So I know that you've always practiced eat when you're hungry, stop when you're full, and I know that you are an advocate of fasting to the point of hunger. Is that correct?
Well, right. So, we've come through a time period where the food for most people is just so plentiful that we've been eating too much. So to say you don't need to eat too much, I mean, it's kind of absurd that I have to tell people it's okay not to have 3 meals a day. I mean, well, but what about breakfast? It's the most important meal of the day. No. I want people to eat high quality, great food. Keto is a way to do that. And then if you're not hungry, that is a signal that your body is satisfied. So, you wouldn't go to the gas station 3-5 times a day if your gas tank was full, right? So if someone's trying to solve an obesity problem, basically you have too much energy on your body, it's stored as fat. You don't want to consume more energy when you're trying to get energy off your body. So yeah, I think fasting or intermittent fasting in general is a great concept because it just tells people they don't have to eat so darn much.
So let's understand this and break it down a little bit further. So when somebody is on a keto diet, they are fat adapted. In other words, they are using an alternative form of fuel for their energy. What actually happens, just correct me if I'm wrong now, is that their body doesn't go into a stage where it's not finding nutrition. It actually, when you're not eating, it actually finds the nutrition that it needs by using the fat stores on your body. So it's actually not starving itself at all. It's actually feeding off your pantry on board, your own body fat.
Right. Yeah. And, a common thing to keep in mind is that you're going to burn what you eat for energy. So if you eat sugar or drink sugar and starches get turned into sugar, you're going to be burning sugar in your body, not fat. And if you're trying to lose the fat off your body, which is the treatment of obesity or overweight, which most people do a keto diet, or it's well known for that, the fact that you're not hungry on a keto diet means that you're accessing your body fat store appropriately. So in my mind, the things were messed up before. Why is someone still hungry if they could live for 6 months with the fat on their body? That's how I got into this. Why is this happening? And one of the reasons is when you eat and drink carbs, the sugars and starches, you have to burn them. And that means you can't burn your body fat. So it's like an accelerator and brake on a car. If you're a fat burner, that's the accelerator. You want that. But every time you eat sugar or starch, you're putting on the brake on the fat burning. And ketosis comes into it, and it's known as a keto diet because when you're a fat burner, there are molecules that you can measure called ketones, and those go up a little more than if you were not on a keto diet. And because you can measure them in the urine, the blood, the breath, that's why it's called a keto diet. But it's really a fat burning diet, meaning and if you're trying to lose weight, you're burning the fat off your body. Now, not to worry, if you're lean, you're not trying to lose weight, your body will just burn the fat that you're eating. So you won't whittle away to nothing. I mean, the thing that is pretty obvious, animals that are carb avoiding, so like carnivores, they're basically doing keto diets, and they don't whittle away to nothing. I mean, when they're hungry, they eat, and this was all worked out in my early career, that if you just took the carbs away and you put them on a research board, people will eat the protein that they need. And the fat comes with the protein if you're eating real foods like meat and poultry and shellfish and seafood and eggs. And so it doesn't have to be difficult. The fasting comes in when you're not hungry, don't eat. So most people end up eating once or twice a day automatically from within, just because they're not hungry. So I'm not a big fan. My teaching doesn't say, power through 18 hours. If you're hungry, just don't eat because you're intermittent fast. No, my style, because I want to do something as healthy as possible for people and treat as many people as I can. When you're hungry, have something, but just a little bit. And what happens over time is that hunger fades away, or what we say is it normalizes. I mean, you shouldn't be hungry 3 times a day with 2 snacks and all that. I mean, this is just, that becomes inconvenient even. So fasting is okay, but I first want you to understand that it has to be great food that you're having. And if you're having a lot of hunger, then that's you're either not doing it right or it's not right for you.
Now, in the context of fasting, even though we understand your stance, we understand that your stance is, what sort of liquids should one be having if you are wanting to do some form of intermittent fasting, or you skipping out breakfast, or you skipping out lunch or dinner, or a combination of those?
Yeah, so here's where the balance and individual compromising or making adjustments for people. If it wasn't long ago when all there was water or tea. I guess the alcohols came about to keep water clean. You couldn't drink water, so you purified it. But so in order to keep people happy, satisfied as they're transitioning, I think any kind of beverage that doesn't have sugar in it is okay. But oils and I see people adding butter and coconut oil, these, and MCT oil, medium chain triglyceride oil. I think these things overly complicate the idea of fat burning, and I want the ketones to come from your body, not from what you eat and drink. So I think in terms of drinks, there's a wide array of things you can have, and in my approach, I think it's okay to have sweet things. It just can't be sweetened with sugar. So yes, ideally, water or water with some kind of citrus added, if you like, that would be great. But coffee and tea have no carbs in them unless you add coffee and tea to them. And in my experience, people can be very successful drinking coffee and tea, even with creamer and sweeteners. And that's where I do things that are practical with advice, not dogmatic. No, you can't have caffeine or all these other things. Or you can't have artificial sweeteners, and because I want this to be used by as many people as possible. And in my experience, these things are not a big factor, or not a big barrier to having it work.
Great. I think that's all the questions I had for you on fasting. Got a couple of questions though. One of them is from Charmaine, and Charmaine asks, what are the negative side effects of extended fasting? So first of all, what is your idea of an extended fast? Maybe just define what an extended fast is. And then what are the negative side effects of extended fasts?
Well, this is what I would say is expert advice now, because there are not a whole lot of studies on long-term fasting. And, you can think to history and religions of fast, but that doesn't, I want more than that. The concern, doctors used to fast people all the time. I mean, this was before my time in the mid 1900s. The best weight loss will be from getting people not to eat anything. And that's not the healthiest way to do it, though. So what we are concerned about with long-term fasting, and I would say more than a day or two or three, I'm not concerned unless you have other medical problems and you're on medications. I'm not concerned if you go a day or two without eating. I mean, I've seen people sick in the hospital not eat for a week or two. I mean, your body's going to figure it out. But again, I want it to be the healthiest way. And that's where the concerns come in about long-term fasting or doing fasting without regard to having great nutrition. My teaching is that you should have one meal a day. It's going to be protein. I don't know how much. And if you eat, animal products, you're going to get fats with the protein. So I don't worry about you getting enough fat. The concern is not getting enough protein, and that your body will start burning its own protein, which is stored in muscle for the most part. So the loss of muscle mass is the concern on long-term fasting. Now, I know there are a lot of what we call pundits, meaning, experts who say, don't worry about that. And yes, you can measure your own muscle mass with techniques that doctors have, which would be a great tool to make sure you're not losing muscle mass. Your strength is a good indicator, but not perfect, of your muscle mass. Until the research is worked out about how low you can go on protein without harming the muscle, I'm still a little reluctant to say it's okay to go more than a day or two without eating. And I guess the other extreme, we know that if someone gets weight loss surgery, and that's my world of obesity treatment. I'm past president of the Obesity Medicine Association, the medical weight loss doctors, not the surgeons. The kind of ugly truth about weight loss surgery is the weight loss is so fast and so dramatic that just about everyone loses muscle mass, and in some cases a lot. And so you might notice someone who's had the weight loss surgery, they don't look healthy. The weight loss can be too fast. And that's the concern about long-term fasting and intermittent fasting, eating one meal, 2 meals a day when you're not hungry because you're eating great foods on a keto diet. That's what I have the most experience with. And I think the science supports that the most.
Awesome. Bev says, I eat dinner at around 6 p.m. and the next meal is lunch the following day. Would you consider this intermittent fasting?
Yes. So actually what I'll say is when I teach someone and they say they're doing intermittent fasting because they're doing 18-6 or is it 12-12, I mean, you can basically do the different types of fasting. And if you want to call it that, great. But really what's happening is you're not eating because you're working off your onboard pantry, the fat store, and you're having an appetite reduction automatically. If you want to call it that, great.
Right. So while you are specifically not eating nutritional value of food, your body is still finding the food within your body. Okay. Yeah. Last question is from Derek, and Derek says, I've been using intermittent fasting as part of my lifestyle. Do you think this is healthy? I think you've answered this question. And intermittent fasting, to recap, you say is definitely fine if you're on a keto or low-carb diet.
Right. So my first question is, what are you eating? So right. I'll cut to the chase. I'll go to the core and say, just write down what you're eating and drinking for me, for 3 days, or over the phone. Just tell me what you're eating and drinking. So the nutrition has to be optimal first before I'll even say that intermittent fasting is okay. I mean, imagine it's the college diet where you just have sugar and you're just having sugar once a day. This is not healthy. So we want this to be as healthy as possible, and intermittent fasting, when you're eating a keto diet, is actually part of the way it works. So it's actually part of the mechanism of why you eat less, and then you start losing your body fat so well.
Eric, thank you for your words of wisdom. Always a pleasure to hear what you have to say on these topics. If you enjoyed this video and you would like to see further videos, you can find us on our YouTube, Instagram, Facebook, and Twitter accounts under the name of Adapt Your Life. And if you're watching us on YouTube, please don't forget to hit the notification bell to be alerted the next time we post one of our videos, which is typically on a Wednesday. And not only that, if you enjoyed this video, please would you give it a like and a share. It would mean the absolute world to us. This is Dr. Westman and myself signing off on another episode of Conversations with Dr. Westman. Eric, thank you once again. Thank you so much.
Thank you, Glenn. If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.